Hello everybody, it's nice to meet you again. You are watching Dr. Akinclicks and I am Dr. Akin. Today I am going to share with you a very important health related issue, especially during the lockdown. As the number of cases in India are rising, the government has imposed partial lockdown, and in the due course of time, who knows, there may be stricter lockdown. I am going to discuss with you a very important health related issue which you cannot ignore, and if you ignore it will be very serious consequence on your health. This we have seen during the strict lockdown which took place 1 year ago. So with that experience I am going to share with you. So please be with me till the end of this video so you can know what is the importance of this talk and what is the importance of me sharing this issue with you today. You and all know that when the first lockdown was announced in India, it was a very strict lockdown, one of the strictest lockdown in the world during this COVID-19 pandemic. As the disease was unknown, as the disease treatment was also unknown to the medical scientists and doctor, we all were scared and we all were almost in a very scary situation. We were told that if you move out of your homes, you will contract the disease and the consequence shall be very serious. So we were all told to be within our homes and not venture out unnecessary, and every walks of life in India came to a standstill because the scare of the coronavirus disease was so high that people even stopped visiting hospitals for treatment, and even when they were sick, people were scared to visit hospital, thinking that they will contract this deadly disease and they may die. And so people, those who were sick, those who needed treatment, they were also not going to hospital, and the consequence was that they become sicker and sicker, and some people even become worse because of the fear and not going to hospital and not getting treatment on time during the lockdown and during the pandemic. I am also going to share with you an incident. The incident was that during the first lockdown, which was a very strict lockdown, during that time, one village person went to a jungle, to a forest, climbed up a hill for agriculture activity, and during the course of time he had a fall from a height. So after having the fall, he complained of severe chest pain, and it was obvious that he sustained injury because of the fall and he had fractured his rib. I was informed by his son that his father is having severe chest pain after falling from a height, and what to do. I told the son that please take your father to the hospital. He needs urgent chest x-ray to see whether there is injury or not, and I was suspecting that there must be surely a rib fracture and there must be a pneumothorax. That means because of the rib fracture there is injury to the lung and of excess air in the lung, and the lung is being compressed by this air and the lung will go into collapse, and he may have further difficulty and even lose the lung if he does not get treated. On explaining and on asking this patient to go to the hospital, the children and the patient said that, "Doctor, I am scared to go to hospital. I am scared that I may contract coronavirus disease during the journey to hospital as well as in the hospital." I said, your illness is very serious and you need to go to hospital, otherwise you may die of this injury, die of this suspected pneumothorax. So please, you go to the hospital maintaining all the COVID appropriate behavior. It was not an easy task to convince the son and the father, but finally I could convince them and they went to hospital. And at the right time, when they went to hospital, there was a pneumothorax and the doctor treated this excess collection of air in the lungs with a chest tube drainage. So if the patient had refused to go to hospital, the consequence could have been very, very severe and he might have lost this patient. So because this patient went to the hospital with COVID appropriate behavior after the advice of doctor and not getting scared that if I go to hospital I may contract the coronavirus disease and I may die. And we know that many patients could not visit hospital during the strict lockdown 1 in India, partly because the lockdown was very strict, because no movement was allowed, and also partly because the patients themselves were very scared. They thought that if I go to the hospital to get treatment, even though I am having illness, but if I go to the hospital to get treatment, I myself may end up dying because of the coronavirus disease. Because of these people, those who were on follow-up treatment, those who were supposed to go to hospital, those who were having disease or those who had developed new disease, they did not visit the doctor nor consult the doctor. And we also know that because of these people not visiting hospital and not getting the right treatment at the right time, the disease became worse and worse, and it worsened so much that some people's life are in danger and the illness could not be reverted. I'm going to impress upon you all is that as the cases are rising in many states in India, and the record number of cases have already broken the previous record in India, and there are partial lockdown in various states in India. Please remember that if you need to follow up with your doctor, first of all, please contact your doctor through phone, through WhatsApp, through Skype, through Google Meet, or in any way. Please try to contact your doctor, and if it can be done without physical appearance of you in the hospital, please get the treatment properly and please continue the treatment of your disease. Doctor insists that your physical presence is needed in the hospital to examine you, to evaluate you, and to carry on the treatment in a proper way. Please ensure that you go to the hospital. For this, what you have to do? For this, you first consult your doctor over phone or through Skype or through WhatsApp and get a note from your treating doctor. The best thing is that after getting the note from the treating doctor, you approach the respective magistrate in your locality who are authorized to issue you a movement order, so that even though there is strict lockdown in your locality, you are able to move from your home to the hospital or from your home to the treatment center. Don't hesitate to contact your treating doctor, to contact your treating hospital and communicate with them. And if you are in need to be presented before the treating doctor or hospital for further treatment and for further expert evaluation, please proceed to the hospital after getting movement order or transit permit from your respective issuing authority. Sharing this because as per the experience, as per the information which I get from my doctor colleagues, it has been noticed that many of the disease which could have been controlled and which could have cured completely if the patient had visited the hospital or contacted the doctor, as soon as they notice abnormal physical illness in their body, that disease could have been nipped at the birth and treated completely, and the patient could have regained to normal health. But it was noticed that because of the strict lockdown, when people even were very scared to go to the hospital and see the doctor, nor they contacted the doctor through online, they just remained at their home because of the fear of contracting the illness of coronavirus and because the fear of moving outside their home. By the time they reached the hospital after the lockdown was lifted, the illness became very severe and the treatment became very difficult, and in some cases the treatment could not salvage the patient from the deadly illness.